Okay, thanks, Sam. Welcome everybody to Board of Health for the month of February. We are still awaiting approval from the legislature on 2 of our members, so we don't have quorum for this meeting. So we are going to just spend our time with some updates. So we also don't have anybody for privilege of the floor, so I'm going to skip that. And I would ask that for our next agenda in March, where we will hopefully have everything approved and ready for quorum, that we will be approving and reviewing 3 sets of minutes from December, January, and now February as well. So with that, I'm going to go ahead and give the floor to Brenda to provide the financial summary.
So there was not a financial summary in your packet this month. We are continuing to work on, and actually just completed Friday, the 4th quarter state aid claim. Had to go through and revise to do the imminent threat, which is when our CD line exceeds our projected expenditures, we become eligible for 50% reimbursement on those expenditures versus 36. It didn't make for a huge dollar difference, but nevertheless, it was something we had to revise and file. So we have filed that. We were waiting, this morning we were waiting for signature in order to get it to the state. So we continue to work on a variety of different COVID-related grants, and trying to balance out our books from both 21 and now we're having to do the same with 2022. So hopefully next month you'll have a kind of a closing report for 2021.
Okay, great. Thanks, Brenda. Any questions on budget? Okay. So Frank isn't here. So I was going to skip administration unless there was somebody else that was going to do updates, but I was assuming that was going to be incorporated into some other folks' reports, and I'll go right to health promotion. So Sam.
Yeah, thanks, Christina. Hi, everyone. So I don't have much to add to my report, what's in the packet, but we are starting interviews today for the health educator position, which is, again, a combination position between 2 grant programs. We have the Healthy Neighborhoods program and the tobacco-free communities. So hopefully we'll be onboarding someone in March. And then otherwise, just I wanted to update the board on our strategic planning process. We spoke with, Frank and I spoke with both Christina and Maria, the chair of the Community Services Board, a couple weeks ago, and we have the main development for the integration cross-functional team that we've had working since the fall is that we did interview branding development agencies to assist us with our development of the new logo and name for the combined mental health and public health organization that reflects our new identity that we developed during that strategic planning process. So, so we actually did complete those interviews and selected an agency last week. Frank was very involved with the process, as well as some of our staff. And we are excited about the vendor that we selected. So our next steps are to finalize a contract with them, and then we'll be able to more publicly announce them. And we spoke with Christina about how we are hoping the board can be engaged and involved, both boards, as we go through this process of naming and logo development. So in speaking with Christina, and she can chime in too, but it seemed that because you are all very busy, that when we get to points with this branding development agency where we need input or would like to share the progress with the board, maybe have the agency present directly to you, we will most likely add on some time to this existing meeting if that works for everyone. But I'll let Christina discuss that a little bit more. So that's our plan. I think it will be like a 3 to 5 month process, hopefully starting in March. So that's the update for that. And then we have another cross-functional team of staff working on internal understanding of services and programs across the organization, and Claire and Debbie have been pretty involved with that. So there will be more updates coming, but right now is this branding development. So thanks.
Thanks, Sam. And I would just remind the board members of 2 things. First, that I think it came from Frank. I'm sorry, I have my email closed because I didn't want it dinging throughout the meeting, but Frank did send out to all the board members summary information. So that should be in your email somewhere. So you have a sense of sort of what's happening behind the scenes, even though we're not involved in every single step of it. And then if anyone has concerns with the strategy of trying to leverage time during these meetings that most of us already have blocked on our schedule, as opposed to trying to schedule additional or separate meetings to have discussions about brand integration, just let me know. But I guess from my perspective, it seemed like that was probably an easier strategy to figure out a way to incorporate time when we're already scheduled to meet, rather than trying to do lots of separate meetings for board input. Yeah, okay. So if anyone has concerns, just let me know. But I think that's the strategy that we'll use, unless it becomes apparent that that's not working for us for some reason. So, okay. Okay, thanks, Sam. So any questions for Sam from board members on that? Okay. So next up then is our medical director's report.
Hi, and good afternoon. Almost like spring out there.
Yes.
Sam, can I share my screen? I'd like to just give you all an update. You've been getting my bulletins, I believe, so that you really have a good sense of what's going on. But let's take a look at a couple of things. If you look at active COVID hospitalizations, we've gone into the single digits. When we were up in the 20s, went down into the teens for a while, and now we're coming down into the 7s. So things are a bit more manageable for hospitalizations. There's one of the things that's occupying their time at the medical center and so on is to get everybody the mandatory healthcare booster that's mandated for healthcare people. If we go to looking at, don't want to do that. That's not what I want either. Let's go back over here. There. And I've just got to move the panel that's all the pictures that gets in the way. There. So the important thing here is this trend, 7-day average trend in our cases. So now we're down into something a bit more manageable, aren't we? These, again, you have to be reminded, don't include at-home testing. So this is only reported tests, largely PCRs that come through. And then we're still at this fairly sizable number for community transmission. And that's defined as, excuse me, the total number of new cases per 100,000 within the last 7 days. So even though we're at only 30 cases a day, we're still above 200 in the level of community transmission. And this drives certain measures, as you might remember. The most notable one probably would be masking advisories. So it's only when you get down to very low numbers that that you're deemed to be in low prevalence. The testing positivity, you can see, really fell off. So we're now down less than 2%. It is very important what the denominator is here and who's going for testing, because you can get a lot of dilutional effect. And of course, as we got into this part of life, we started getting testing results recorded from higher education, doing surveillance, et cetera. So let me shift gears a little bit. Point out that seasonal influenza, since I put out my board report, is still on a downtick. Very remarkable, but very fortunate. Boosters, who should get a booster? The New York Times is reporting on a couple of studies in today's paper, which are indicating that for the vast majority of people, their immunity with a third dose is not only boosted and level, but the diversity of the antibodies is enhanced. So not only do they get a boost in the quantitative level of antibodies, but they get a broader spectrum of antibodies. The speculation, and it's only speculation, is that fourth doses may not be required for many people, and maybe only for based on age and high-risk conditions. We'll see that. We'll see how that turns out. It's too early to say. But currently, again, people should get that third dose. It makes a great deal of difference in terms of the level and the breadth of your boosters, and it continues to enhance minimizing severity. Skipping down here, in terms of variants, as you know, we no longer have local data for our region due to several issues. The research lab at Cornell is unable now to do the specimens. So we're looking more at New York State data. And that continues to show Omicron as the 99% variant circulating. The possibility of other variants coming along, of course, is there. And we need to not only be prepared to deal with that should it come along, but we also need to take out some verbal insurance with the public, not to get downhearted or dismayed if another variant or two come along, but be assured that if they are fully vaccinated and gotten their booster, that they are likely to be very well protected. As I mentioned, the breadth of the antibodies should enhance their protection against other variants that would pop up in the future. This is the picture of the variants. You can see the rapid rise here in Omicron, and it's still staying at a high peak.
Dr. Claypack, we're not seeing that. We're still seeing your positivity, your percent positive tests.
Oh, really?
Yeah, can you? Yep.
Let's do this. We'll stop and then we'll start again. That might work. Oh, there's many a slip twixt a cup on the lip. How about that? Oh, do you see this graph now?
Yes, thank you.
Okay, very good. You see the rapid rise of Omicron and then its persistence here at high levels. Let me skip down here a bit. Here's how we look compared to other counties in cases per 100,000. Here's Tompkins County. And obviously the colors, as you go darker, you're worse. So we're pretty much in league with other immediate counties to a large extent. And here with regard to test positivity, you can see we're far less in how many positive tests we have. But again, you have to bear in mind that there may be some dilutional effect going on, but also these surrounding counties are only testing maybe half or less, or fewer, I should say, people compared to what we're doing still. Reinfections. So Omicron has caused a lot of cases. And when you look at reinfections, there have been a lot of reinfections. But what is the percentage? Does it make the likelihood of getting reinfected more, higher with Omicron than other variants? And the answer to that seems to be no. That it tends to be a far less common event, and that by and large people are protected from reinfections. And the similar story with regard to breakthrough infections. If you're vaccinated, how likely are you to get infected? And again, it appears to be that the data is demonstrating that the rates are very low. So there's a high protective effect of the vaccines. So those are the latest things in regard to that. I've already talked about hospitalizations. We still have a role for masking and distancing. There are, I believe, 3 things that need to be accomplished before we can begin to call this an endemic disease. An endemic disease should be one that we can predict the incidence of, and that we have strategies to control, and that our masking, distancing, and so on, we employ as we need to in a thoughtful, mindful way to reduce risk. And we're not quite to the point where this disease can be called endemic. It's still a pandemic. And so we aren't at the point where we can just throw caution to the wind. So using appropriate masking, and then I would add that our advisory from our health department stands that people should mask if they're in a situation that is not comfortable. They should consider masking if they're in a public space, in businesses and so on, even though New York State has removed the public masking mandate. I'll end here pretty quickly. I'm sorry to go on for so long. I wanted to talk to you a little bit about cannabis. As you know, excuse me, the Office of Cannabis Management is continuing to staff itself. It does have a board. It does have some staff. They're continuing to recruit other staff. They are expecting that in the spring that they will have rules and regulations coming out for submitting applications as growers and producing cannabis. Partially that's due to the need for respecting the growing season. So your growing season starts in the spring, but rules and regulations for retail sales and for consumption places are likely to take much longer. Earlier, they had said about a year, 18 months before they had everything ironed out. There'll be a 60-day comment period that'll follow this promulgation of rules and regulations. On some of the interesting discussion that occurred on the presentation given by the OCM, and they did a number of these for different regions of the state to try to inform the public about what the law covers. Considerable time was spent talking about sticker sales, something we talked about earlier, where a business sells a sticker, and then when you get to the cash register to pay, they give you a little present of some THC. They clearly said this is an illegal operation, that they have sent out cease and desist orders to businesses that are doing this. If they are made aware of other businesses, they'll do the same. And if those businesses continue to do this type of activity, they'll take further steps in the legal realm. So interestingly, they need yet to consider whether, besides these retail outlets, they would allow THC sales at festivals and caterers and restaurants and so on, and what other products could be sold at these retail locations. I believe that pretty well covers some of the stuff I thought would be of interest to you. And please feel free if you have a question to ask me.
Great, thank you so much. Any questions on that from board members? Sue and then Ed.
Yeah, Dr. Claybeck, you mentioned in your report an increase in opioid deaths and consumption facilities. Is there any progress on the front of trying to support and open consumption facilities in New York State that you know of?
Well, certainly New York City has two that now are in the early months of operation. And I suspect the data from those is going to be closely scrutinized in order to see if that model should be promulgated in other places of the state. Currently, the process in Ithaca for a consumption facility is treading water for a number of reasons I'm given to understand. So I wouldn't expect to see anything particularly happen on that in the near future.
Great, thanks. Ed?
Yeah, hi. Bill, can you just remind us of the which data point is utilized to decide when the mask mandate will be dropped in the county? And what number we're looking for?
You know, it's pretty low. You're looking at a, excuse me, a community transmission rate of something on the order of 10 to 15. It's extremely low. At a recent meeting, I believe I'm not misquoting Frank when he was talking about wanting to see that before we would change our advisory.
Is that the 7-day new case average? Is that the
7-day total, 7-day, not average, but 7-day total cases.
total cases? Okay.
Yeah, so if you're, excuse me, talking 10 to 15, you're talking very few documented cases.
Very low. Yeah. Okay, great. Thanks.
Great. Any other questions? Okay, so Claire, I think we'll move on to your update.
Hello, thank you. So this report covers the month of March. Obviously, as Dr. K just kind of highlighted, cases really have slowed down here. January 28th marked the significant moment of transition. For all of the cases, the investigations in Tompkins County, they're now done by New York State's Department of Health Virtual Call Center. And we've really phased out almost all of our temporary COVID response team. So we are incredibly grateful to them for all of the work that they've put in and all of the helpers with other county divisions that really pulled through to the last moment. At this stage, we're working to monitor quality, to provide support and oversight to the virtual call center as they need it. And with this so-called phase of self-management, we're shifting our attention to higher risk congregate settings and providing support to organizations and companies if they need or want it. We have 2 public health fellows who are supporting these efforts and also getting involved in other work at the county that was deprioritized while COVID was really our focus.
Claire, Claire, who are the public health fellows? Just so.
Oh, yes.
Yeah.
I couldn't remember if we had talked about them last month. And technically, Brenda is kind of overseeing with Frank the program. I am working closely with them until we fill the coordinator position, but we have 2 wonderful public health fellows, Shuai Yuan and Dorota Kosowska, and she has, both of them have been working with the county on COVID response and then are now able to sort of integrate in this new role. The program is new and it's a statewide program. Brenda can maybe fill in anything else, but they're really intended to support local health departments and also as a opportunity to kind of build the new public health workforce and give them opportunities to grow in their careers through exposure to all the work that we do. So there's a mentorship component, maybe reaching out to some of you. And yeah, I think there's a lot of possibility and opportunity here to make it what we think is most effective.
Sue?
Yeah, I just wondered, is that a one-year position, Claire, for the fellows, or 2-year?
It's a 1-year commitment with, originally the program was intended to be 2 years, and there were significant delays in the program getting started at their level. And so we expect that it may continue to complete the full 2 years from when they started in January, but we're not sure yet.
Thanks, Claire.
Sure.
And I interrupted you, so.
Well, I'm almost done.
Okay.
So really excited to be kind of restarting and planning for our non-COVID related services. I think we included a lot of those updates in the report. I did want to mention that the WIC RFA application went in. Huge congratulations to the team. It was a really significant effort and they did a magnificent job on the application. Subsequently, there was an error at the funding agency that will require resubmissions from all the applicants. So we're kind of sorting through those details. Brenda, I don't know if you have any further information, but we hope that it's a fairly straightforward process. So
We haven't received anything further. My suspicion is that they had posted addendums really late in the process. In fact, I think there were probably already applications submitted and then submitting addendums, which I don't believe they can do as late in the process as they did. So until it comes back out for submission again, we really don't know. We're hoping that it's not big changes and that we can just cut and paste and resubmit. It's a tedious process, but hopefully there's no huge changes to the grant process.
Claire, there was quite a bit in your report about syphilis. And I was hoping maybe you could touch on that for a couple of reasons. First of all, just because to start talking about some public health issues that are not COVID. And second, because it seems like there's some state advisories in addition to local concern on that. And then third is that I just wanted to also maybe talk a bit about whether if there's any social determinant of health issues that are wrapped up in the syphilis discussion that we should be aware of.
Great question. Thank you. I would also defer to Dr. K if he has thoughts on this question as well. So yeah, from what I understand, there was an advisory issued by New York State Department of Health regarding the rates of primary and secondary and congenital syphilis statewide. They have been increasing. Here in Tompkins County, no cases of congenital syphilis at the moment. But I think what we are hoping to do as we pick up our non-COVID work and start to kind of integrate working with provider offices and kind of just doing in-service kind of work together to ensure that lots of kind of support available for checking. I think congenital syphilis, for example, is preventable if it's tested for in the first and third trimesters of pregnancy. And so, those are areas where we can collaborate better with providers to ensure that we're able to pick up. In terms of social determinants of health, maybe Sam also has some thoughts on this, preventing sexually transmitted diseases, or at least catching them early and working on on treatment.
Right, because it also just seems like it's an access issue. I mean, it's preventive, but it's preventive if you are seeing an OBGYN or some sort of medical provider. So that's why I was sort of interested in it. And it seemed to align with some of the other work you all are trying to do.
Yeah, certainly an access issue. So it's good to go back and think about congenital syphilis. The standard of care is to do a number of tests when a person presents to a practitioner who's starting pregnancy care. Any of you who've been pregnant know there are quite a few. One of those is syphilis as an initial screen, but pregnancy takes a long time. And if you acquire syphilis subsequent to that initial testing, you can then infect your unborn child. And unless people are aware that you've had either some risky sex or that your partner or partners are not entirely reliable, you won't necessarily recheck for syphilis as you go down the road, 7th, 8th, 9th month of pregnancy and so on. So it wasn't detailed in the New York State Department of Health bulletin exactly when these cases were occurring. Most of these cases were not upstate cases. As Claire mentioned, none of them were in Tompkins County residents. And if you looked at upstate over the last 3 or 4 years, the rates didn't seem to be really remarkable. So I don't think we're looking at a tip of an iceberg here, but I do think that it's a good opportunity to do a case review and just use that as a time to remind practitioners to continually take into account the social profile of the person that they're taking care of. A lot of things happen in the course of a pregnancy. And one of those can be exposure to all manner of infectious diseases. So I think while we haven't had any cases in Tompkins County, we can certainly include in my practitioner bulletin mention of what the data is and help to prompt people to remaining sensitive to it. We do, Claire, perhaps Sam can remind us, over the last 5 years, we have had a focus group of facilities and practitioners in the county who have focused on syphilis and STDs, particularly when we were seeing uptakes linked to sexual encounters that were done using anonymous apps. And particularly in our frustration about we can't even trace those cases because it's so anonymous. So I believe that those kinds of liaisons are still present, but maybe COVID derailed some of it. I wouldn't be surprised. So I don't know. Sam, do you have an update on that, or are you familiar with it at this point?
Yeah, we do have a coalition to specifically address STDs, and I was going to say that I'll check in with some of the nurses who would be the ones to coordinate that meeting, because I don't recall us having one of these coalition meetings during COVID. So perhaps it's time to get something scheduled so that we can have a bit more discussion about it, because I think your point about, if people are not already involved with a medical provider and, accessing medical services, then they're probably not getting tested. So I know that coalition involves like Planned Parenthood and other providers in the community. So I'll look into that and see if there's more discussion and promotion that can be done through that group.
Great. Thanks, Sam.
Yeah, thank you for
Okay.
that question, Christine. I just wanted to
Oh, yeah.
mention too, because we have so many new team members and we're also just finalizing recruitment for our community health nurse who'll be focused on communicable disease, taking over from Nanette. We're in the process of really kind of refining, planning, strategizing. So this, just your question and some of the connections that Sam and Dr. K made will be helpful as we work through that. So thank you.
Okay, thank you so much for that. Okay, other questions on Claire's report? Ed?
Yeah, can you tell us whether historically, whether the demographics of the people with syphilis in our community have been mostly college students, or has it been in the general community?
My recollection, without having any numbers to be able to put to it, is that it covers a broad age demographic. Certainly there are higher education aged individuals in that mix, but we have had 40-year-olds, 50-year-olds who have turned up positive, but I don't have exact, percentage breakdowns or anything.
I do have 40 and 50-year-old patients at Cornell. So they are college students, but they're older.
Right, okay. To go farther and take that age and then break it down versus higher education versus not, that may not be a data point that we have. I don't know.
Okay, great, thanks.
Yeah, I think it actually may be data that we can pull, but again, it has not been updated in a little while. So, something else I can work on pulling and we can update at the next meeting.
And granted, our population and the college population does have access generally to care and testing, much more probably than the regular community does.
Great, thank you. Any other final questions on this? Yeah, Sue.
Claire, I noticed that there were 13 cases of Lyme disease in January, which seems weird to me. Do you have any thoughts on that?
That's an interesting point.
I think that's the total number for the year.
Yeah.
Is it? It's not. I don't think we saw the actual number for the month, did we?
It's on the monthly one. The month of January.
The title of the annex was
It's on
year to date.
Page 30 of the packet.
I think they're the same chart.
Oh.
Yeah, that may explain some confusion.
Okay, so you're right. The data is the same, but it would be the same, right? Because it's for the calendar year. So the monthly one in January is the same as 2022.
Yeah, that's exactly right. So you'd have to go back to 2021 to be able to see month by month and then year to date.
Anyway, I just wondered if anyone.
Yeah, I can get back to you on that.
Thanks.
Hey, anything else? Okay, Deb, I think you are up, if I'm remembering correctly. Yes, Deb, you are up next.
Hi, everyone. I just want to give you a little update on last month. I talked about our provider shortage, particularly for speech therapy. We have had some creative scheduling with some of our speech therapists. I've been working with them to see how we can get more children off that wait list. And we've been lucky to have another agency hire. There's still 30 plus kids on the list, but there is some advocacy work going on in New York State from the Children's Agenda group out of Rochester and Common Ground out of Rochester. And they're doing some advocacy at the state level. Once I have more information on that or some links I can share, I'd like to send that out to you all in case you want to do some advocacy for us. Thank you. That's all I had to say.
Thanks, Deb. Any questions for Deb? I'm glad to hear that there were some creative solutions to the shortages.
Yes, me too. We have some wonderful therapists that really want to see these kids taken care of.
Yeah. I don't think our county attorney is on today, so I will skip that report. And then Liz isn't here, but so Skip, are you sitting in for Liz for environmental health?
Yeah, I am, but I'm just here for questions. I don't have any new additions to the report. So
Okay,
if anyone
great.
has questions, I'll try to answer them.
Does anyone have questions on this, on the report? Not to lengthen things, I did have just one question because I noticed that the meetings with grassroots are starting with health and safety stuff. So I think I wanted to get a general sense of how we feel, like where they are in the process. Are they where they need to be? Are we missing information from them? Just to kind of give us a heads up of kind of what's coming, because I think this is about the time where we start to want, things pretty solid from them. That's been challenging for them.
Yeah, right. We're waiting on some updated maps to come in. So we expect that those are going to be coming in any day now. I think that's more of a push on their end because they're looking to start getting tickets out for sale. But so far they've been meeting the deadlines that we've set forth in the prior Board of Health action. So, but things are moving in a good direction so far.
Great, thanks, Skip. Any other environmental health related questions for Skip? Okay, we're gonna let you off easy today, Skip. Harmony, could you give us an update from the CSB?
Sure. So the Community Services Board is continuing to work on its bylaws and also looking at some of the merger activities that Samantha talked to earlier. Next month, they will be focusing most of the meeting to fentanyl overdose. They're going to have representation from providers in the community, as well as a parent who lost a child, an adult child, to a fentanyl overdose, and really seeing where are we at in terms of an increase in fentanyl exposures and all sorts of drugs, not just in opioids. So that's going to be our next steps. In other news, we did a request for proposals for a pharmacy to be located in our building to primarily serve. It's really going to be focused on serving the mental health needs of people who attend the clinic and our personalized recovery oriented services program, because it's often challenging to have a conversation, maybe with your pharmacist in the general pharmacy, and maybe some hesitancy to have those discussions in an open kind of pharmacy, and have someone with that kind of specialization to work in packaging for some of the people who participate in treatment here who have many different medications they're on. And so some of these pharmacies really specialize in simple to use packaging. So we should know in the next few weeks who will be the winner of that proposal. And we were happy to get 4 bids. So it's a summary of what we're doing.
Thank you. And that pharmacy, Harmony, would be specific only to the clients that mental health serves, or it's going to be a broader pharmacy, but that also serves those patients?
It's really focused on serving the patients that come here.
Okay. Thank you. Any other questions for Harmony? All right, folks. We did have another agenda item about the strategic planning identity branding update, but Sam included that discussion as part of her updates. So unless folks have any other agenda items that I need to be aware of or points for discussion, I think we have satisfied the requirements of our agenda for today. So I would go ahead and adjourn us. So
would you like to hear some speculation as to why children don't get as sick?
Sure. From COVID or from something else? Okay.
So this comes from some research that professor of immunology at Yale has done, and his wife is a pediatric infectious disease specialist, and her research as well. So they believe that children have in three lines of their defense that they have different features than older individuals. So first, they believe through their research that the mucus barrier of the nasal pharynx and so on is different, and that has some impact. And second, they believe that the ability of their T cell and B cell lines for stimulating antibody production and for cell-mediated immunity is quite different. So if you are, and it's different in this way, if you are an adult and you have most likely had experience with coronavirus in your past, they cause common colds and so on, so you've had some previous coronavirus experience. So your immune system, both your, thank you, I just got a present. Both your antibody system is different, and your cell-mediated or T cell system is different. In the case of children, when they encounter coronavirus, they most likely are encountering it de novo without perhaps any prior coronavirus experience. So when they ramp up their antibody production and when their T cell system starts to ramp up, they tend to have less of a cytokine kind of response. And cytokines are those chemicals that are stimulated by our immune system that are the harbingers, not harbingers, but they cause the manifestations of inflammation. And as you probably have read, the people that get into trouble 2 and 3 weeks down the road and end up on hospitalized and on ventilators are believed to have an over reaction immunologically. So kids tend not to have that prior experience. They tend not to ramp up their systems as high as adults might. And that seems to be part of the reason that they tend not to end up in hospital. And yet, of course, saying that, we know that some of them do. There have been something on the order of 700 deaths in the country during the pandemic in children. And so there are other unfortunate circumstances. And the other argument for vaccinating them is that we believe that vaccination lowers the viral load that they express, therefore making them a bit less contagious, and also shortens the period that they shed virus. Because we know that from current information that children, such as my granddaughter here, come over here and meet my Board of Health. Children can certainly be as infectious as adults in spreading COVID. So as we go forward and eventually have a vaccine 6 months to 5 years, telling parents why they need to have their children vaccinated is going to be an important campaign, important to be able to explain to them in a honest and transparent way.
Great, thank you so much. Any questions on that? Oh, and a present too. It's good to be loved, right? Surrounded by love. Thank you. So any last questions for on that topic for folks? Okay. And anything else for the good of the group?
Christina, just one quick thing. I just checked email. It looks like some plans have come in today. So they did have a deadline on for today to submit some plans, and those will get reviewed. So hopefully things will continue to stay on track for grassroots.
Okay, sounds great. Thanks, Skip. All right, folks, I think that's it for the agenda for today. Oh, Sue, is that a goodbye or a question? A goodbye, a Queen's wave goodbye. All right, everybody, have a great month. We'll see you all in March, hopefully as full-fledged voted in board members, so we have quorum. Okay, bye, everyone.